Hi, I'm Dr. Rahul Gupta, Commissioner and State Health Officer for the West Virginia Department of Health and Human Resources, Bureau for Public Health. The Zika virus can be passed from a pregnant woman to her fetus. An infection during pregnancy can cause a serious birth defect of the brain called microcephaly, such as being born with a small head and other severe brain defects. Other problems have been detected among fetuses and infants infected with Zika virus before birth, such as defects of the eye, hearing deficits, and impaired growth. There are several recommendations and special precautions that pregnant women should pay close attention to, especially when traveling. Women who are pregnant should not travel to areas where the Zika virus has been found. If you must travel to one of these areas, or if you live in an area with Zika, talk to your doctor or other healthcare provider and strictly follow steps to prevent mosquito bites and to prevent sexual transmission. If you're planning to get pregnant, you may want to postpone plans to travel to an area with Zika. If you decide to travel to an area where Zika virus is occurring and want to get pregnant, here's the latest guidance from the CDC. Men and women who have traveled to an area where Zika virus is occurring but have not experienced symptoms of Zika virus should wait at least 8 weeks after exposure and talk with your provider. If you visit an area where Zika virus is occurring and do experience symptoms, women should wait at least 8 weeks after symptoms start, while men should wait 6 months. The primary way that pregnant women get the Zika virus is through the bite of an infected mosquito. The virus can also be spread by man to his sexual partners. There are some things about Zika and pregnancy that we do not know yet. For instance, if a pregnant woman is exposed, we don't know how likely she is to get Zika. If a pregnant woman is infected, we don't know how likely the virus will affect her or her pregnancy, or how likely is it that Zika will pass to her fetus. We also don't know if the fetus is infected, if the baby will develop with birth defects. And we don't know if sexual transmission of Zika virus poses a different risk of birth defects than mosquito-borne transmission. What we do know is that in addition to microcephaly, other problems have been detected among fetuses and infants infected with Zika virus before birth, such as eye defects, hearing losses, and impaired growth. Although this virus is a cause of microcephaly and other severe brain defects and has been linked with these other problems in infants, there is a lot more for us to learn. As far as future pregnancies, based on the available evidence, we believe that Zika virus infection in a woman who is not pregnant would not pose a risk for birth defects in future pregnancies after the virus has cleared from her blood. Decisions about pregnancy planning are personal and complex, and the circumstances for women and their partners will vary. Women and their partners should discuss pregnancy planning with a trusted doctor or a healthcare provider. As part of counseling with healthcare providers, some women with their partners living in areas with active Zika virus transmission might decide to delay their pregnancy. Researchers are collecting data to better understand the extent of the Zika virus impact on mothers and children. I'm Dr. Rahul Gupta, and thank you for watching.